Some of the key parameters that feed into the model are knowing the HAI prevalence, and we got that from a small scale study, so we don't know that the information that we fed into the model is correct or precise in any way, so that's obviously a limitation in what we did. Another limitation in the approach that the European CDC did was one of the model parameters is the average duration of an infection in days. And for simplicity's sake, and because of the absence of information on how long an infection lasts, they used a standard number of 10. So in their model, they assume that every infection has a mean duration of 10 days. And I think we recognize that that's probably not realistic, that there are different types of healthcare infections that occur in nursing home residents and they have different durations, and that somehow we need to try and account for that. The example that we show on our presentation is based on small data, which has some limitations, and we're just trying to understand, what factors of the model seem to have a big impact on the numbers that are generated. And we were actually quite surprised by some of the findings that we had, in that change in the mean duration of infection from 9 to 10 days or 10 to 11 days resulted in quite a large impact in the estimate of the model. So when we varied the duration infection from 9 to 10 days or 10 to 11 days, we added 500,000 infections to our estimate, which is a lot of infections for a relatively small change. So we need additional information and more information to make those inputs as accurate as we can, so that we hope that the numbers coming out of the model are more robust.